Okay, let's unpack this. Imagine the raw power and grace of a horse in full stride, whether on a racetrack, a cross-country course, or just, galloping across a field. What if that very act of pushing their limits could actually cause a hidden internal crisis? Today, we're diving deep into equine interstitial bleeding, a condition that's, well, it's as fascinating as it is challenging.
Absolutely. And this deep dive, we're really going to explore bleeding that occurs within the tissues or organs of a horse. So not an external wound, not filling a body cavity like the abdomen. We'll try and uncover the, frankly, surprising array of causes, how you might spot the often very subtle signs, and the intricate diagnostic methods veterinarians use to find what's hidden, plus the treatments available and ultimately what it all means for a horse's health and, of course, its performance.
And prepare for some insights that might truly surprise you, like why the most classic sign people think of for lung bleeding is actually the least common one owners ever see.
Before we dive into the specific challenges, let's just nail down what we mean by interstitial bleeding. So it means blood collects within the tissue itself, right?
Hmm.
Not from a cut you can see and not pooling in an open space like the belly. It's really inside the tissue fabric.
Exactly. And what's interesting is the most well-known example of this in horses is probably exercise-induced pulmonary hemorrhage, EIPH we call it. That's where blood leaks into the lung tissue itself and sometimes into the airways too. But you're right, it's definitely not just the lungs that can be affected.
And sometimes, even though it's technically internal, this bleeding can show up visibly on the surface, like small spots or bigger bruises. Precisely. Yeah, we describe those tiny ones as petechia. They're tiny, flat, round little hemorrhages. Then you have ecchymoses, which are larger, maybe 1 to 2 centimeters, flat discolorations.
Yeah.
And a hematoma, well, that's a larger, localized collection of clotted or maybe partially clotted blood. It often creates a noticeable swelling.
Yeah.
So a bruise you might see on a horse is basically an ecchymosis or a hematoma where the hemoglobin's changed color, giving it that blue or green look we recognize.
Okay, but what actually triggers this hidden trouble? This is where it gets really interesting because the reasons are incredibly diverse. It seems to range from, intense exercise all the way to something like a parasite infection.
Yeah, let's start with the big one, EIPH. It's often called the athlete's challenge for good reason. Essentially, this condition is caused by stress failure of the pulmonary capillaries. Just imagine incredibly high blood pressure inside the lung's tiniest vessels when a horse is sprinting flat out. Their walls are unbelievably thin. They're designed for efficient gas exchange, not for handling that kind of extreme pressure. So that pressure just overpowers them, ruptures them, and then blood leaks into the lung tissue. In more severe cases, it gets into the air sacs and even the airways.
And certain things really ramp up that risk, don't they? The intensity of exercise must be a huge factor. It seems most common in horses doing really high-speed, strenuous work, like racehorses, thoroughbreds, quarter horses, standardbreds, but also barrel racers, eventers, polo ponies. Basically, the faster and harder they run, the higher the risk.
That's exactly right. And while technically any horse can bleed under extreme exertion, some breeds are certainly more prone, mostly because of the intense athletic demands we place on them.
And it's not just about a single race or event, is it? It seems like age and the total amount of exercise play a part too. Like the severity of EIPH tends to get worse as a horse gets older and has more race starts. That really suggests some kind of cumulative damage building up over time.
It does point that way, yes.
Yeah.
There's likely a component of repeated injury and perhaps some remodeling in the lung tissue.
And then there are underlying lung issues, right? Things like inflammatory airway disease or equine asthma. Those can make the lungs more vulnerable.
Absolutely.
Yeah.
Any pre-existing inflammation or disease can potentially weaken the lung structure and predispose them to EIPH. Even things like upper airway obstructions,
Hmm.
laryngeal hemiplegia, the people have called roaring, that can increase the negative pressure swings in the airways during hard breathing, which can definitely make EIPH worse.
So it's this complex mix of intensity, the horse's history, and maybe underlying weaknesses.
Precisely. Now, moving beyond EIPH, trauma is another major cause of interstitial bleeding. Blunt trauma, think kicks, falls, collisions that can rupture blood vessels in muscle, under the skin, or even in vital internal organs like the spleen, liver, or kidneys. This leads to hematomas, those swellings we talked about, or more diffuse hemorrhage within the organ tissue.
Mm.
And in mares, we have to consider periparturient hemorrhage bleeding around the time of foaling, specifically the rupture of the middle uterine artery. This vessel runs within the broad ligament which supports the uterus. If that ruptures, usually around foaling time, it can cause massive, often life-threatening internal bleeding.
Wow, that sounds terrifying.
It can be very serious. And then, of course, there's surgical trauma. If bleeding isn't perfectly controlled during surgery, you can get postoperative hemorrhage within the tissue layers.
Right, makes sense.
Then we get into coagulopathies, bleeding disorders. These can be congenital, meaning the horse is born with them. Hemophilia A is probably the most common inherited one in horses. It's linked to the X chromosome, so it mainly affects males. Von Willebrand disease is another, though less common. Platelet function disorders also exist.
Okay, so inherited issues.
And then there are acquired problems with clotting. Thrombocytopenia, which is just a low platelet count, is one. Vitamin K antagonism is another. This can happen if horses eat moldy sweet clover or sometimes certain rodent poisons. Vitamin K is crucial for making some clotting factors. Severe liver disease is also a big one because the liver is where most clotting factors are produced. And then there's a really serious syndrome called disseminated intravascular coagulation, or DIC. That's usually secondary to severe sepsis or shock, where the clotting system goes haywire, paradoxically leading to both clotting and bleeding. Oh, and we should briefly mention NSAID toxicity, high doses, or prolonged use of certain anti-inflammatories can, in rare cases, affect platelet function too.
That is just an incredibly complex web of potential clotting problems.
It really is. And we're not quite done with causes yet. Neoplasia or cancer needs mentioning. Highly vascular tumors like hemangiosarcoma can just rupture and bleed, or sometimes tumors grow near major blood vessels and erode into them. And finally, though rare, aneurysms and other vascular diseases. A ruptured aorta is usually catastrophic, sudden, massive internal bleeding, or, historically more common, a cranial mesenteric artery aneurysm caused by migrating larvae of the Strongylosis vulgaris parasite, though better deworming has reduced this. And vasculitis, inflammation of the blood vessel walls themselves, can make them fragile and prone to leaking or rupture.
Goodness, that's an incredible range from the, micro traumas of just running hard to birth defects, parasites, even cancer. It's a huge list. So with all those possibilities, spotting the problem must be the crucial next step. It really does sound like a medical detective story. So, okay, what does this all mean for you as someone looking at a horse? How do you know if something's wrong when the bleeding is hidden away inside? What are those subtle signs we should be tuning into?
Well, recognizing the signs of internal bleeding can definitely be tricky because they're often quite general, especially at first. You might notice pale mucous membranes check the gums, the lining of the eyelids. They might look pale or almost white due to anemia, the loss of red blood cells. The horse's heart rate and respiratory rate will often increase. That's tachycardia and tachypnea. Their body is trying hard to compensate for the reduced blood volume and oxygen delivery.
Right, trying to keep up.
Exactly. You might also feel a weak peripheral pulse, maybe in the artery under the jaw. Capillary refill time when you press on the gum, how quickly the pink color returns might be prolonged, longer than the usual 1-2 seconds. And then there are signs like weakness, lethargy, just general depression. Sometimes they seem anxious or restless, maybe show patchy or generalized sweating or even muscle tremors. In really severe acute cases, you could see collapse or signs of shock.
Okay, so those are the general red flags for significant blood loss. But what about specifics? You mentioned EIPH earlier.
Yes, EIPH. This is where that surprising twist comes in. While epistaxis, blood actually dripping from the nostrils, is the classic image everyone has, it's actually the least common sign that owners or trainers directly observe. It only happens in maybe 5 to 10% of EIPH cases.
Only 5 to 10%. Wow.
Yeah, it's surprisingly low. The most common sign, the one reported most frequently, is actually poor performance. Horses might just seem to stop during intense work, they slow down unexpectedly, or show significantly reduced stamina. They just can't finish like they normally would.
So the bleeding is happening, but it's not severe enough to come out the nose most of the time.
Exactly. Or it gets swallowed. Other signs you might notice include coughing, often a dry cough, but sometimes it might be blood-tinged, especially right after exercise. Excessive swallowing after exercise could be another clue, as they might be swallowing blood that's come up the trachea. Also, prolonged recovery time after exercise, or maybe hearing abnormal lung sounds like crackles or wheezes if you listen with a stethoscope.
That 5 to 10% statistic on nosebleeds really drives home how deceptive these conditions can be. It means you absolutely cannot wait for visible blood to suspect a problem, especially in performance horses.
You really can't. Now, for bleeding under the skin or in a muscle, the signs are usually more obvious locally. You'll likely see or feel a swelling, that hematoma we discussed. It's often firm, might be warm and painful when it first happens, and then might get softer over time as the clot organizes. The skin over it might show bruising or discoloration. And if it's within a significant muscle group, it can definitely cause lameness or stiffness.
Okay, that's more straightforward. What about the mare bleeding after falling?
Right, the broad ligament hemorrhage. In those cases, you'll typically see those general signs of internal blood loss. We talked about pale gums, rapid heart rate, weakness, maybe sweating. But critically, it's often accompanied by signs of severe colic abdominal pain that just doesn't respond well to standard pain relief medication. That unresponsive severe colic postpartum is a major red flag.
That sounds like an emergency.
It absolutely is. And for bleeding within other internal organs, well, you'd likely see the general signs of hemorrhage, plus potentially signs related specifically to that organ, maybe localized pain or signs of organ dysfunction. But that can be very hard to pinpoint without further diagnostics.
So if the signs can be so subtle or sometimes mimic other things like colic, how do veterinarians actually confirm interstitial bleeding and track down where it's coming from? How do they solve this internal mystery?
The diagnostic journey really starts with the basics. A detailed history is crucial. We need to know about recent exercise, any known trauma, foaling dates for mares, potential exposure to toxins like rodenticides or bad feed. And then a really thorough clinical examination, paying close attention to all those signs we just discussed: heart rate, gum color, pulse quality, listening to the chest, checking for swellings.
Okay, history and a good look over. Then what?
Blood work is almost always the next step. A complete blood count, the CBC, can tell us if the horse is anemic, if their packed cell volume, the PCV or hematocrit, or their red blood cell count is low. Though it's important to remember in very acute bleeding, the PCV might look normal initially because they've lost whole blood, plasma, and cells together. It often takes several hours, maybe 12 to 24, for fluid shifts to happen and the PCV to really drop, revealing the anemia. Total protein levels in the blood might also be low from losing plasma proteins.
Ah, so the blood tests need interpretation in context.
Definitely. And a coagulation panel is essential if we suspect a clotting disorder. This looks at things like prothrombin time, PT, activated partial thromboplastin time, APTT, fibrinogen levels, platelet count, maybe D-dimers. It helps pinpoint why they might be bleeding excessively. We might also check lactate levels. High lactate can indicate poor tissue perfusion, basically the tissues aren't getting enough oxygen, which can happen with significant blood loss, or hypovolemia.
Okay, so blood tests give a lot of clues. What about specifically for EIPH?
For EIPH, the gold standard, the definitive diagnostic test, is endoscopy, specifically tracheobronchoscopy. This involves passing a flexible camera down the horse's trachea and into the lower airways, usually done between 30 and 120 minutes after strenuous exercise. You can directly visualize blood in the trachea or bronchi. There's even a grading system, usually 0 to 4, to score the amount of blood seen, which helps quantify the severity.
So you can actually see the evidence.
Exactly. Another very sensitive test, especially for detecting less severe bleeding or bleeding that happened days or weeks ago, is bronchoalveolar lavage, or BAL. This involves flushing a small amount of sterile saline into a section of the lung and then collecting that fluid back. We analyze the fluid under a microscope for red blood cells and also for hemocytophages. Hemocytophages are special cells, macrophages, that have basically cleaned up and ingested old red blood cells. Finding them confirms that bleeding has occurred in the lungs, even if it wasn't recent.
It really does sound like a proper medical detective story, combining that careful observation with advanced internal viewing and lab analysis.
It absolutely is, and we haven't even mentioned imaging much yet. Ultrasonography is incredibly valuable, especially for suspected bleeding within body cavities or organs. Ultrasound can identify free fluid, like blood, in the abdomen or chest. It can visualize hematomas within muscles or organs, assess organ damage like a ruptured spleen, and it's absolutely crucial for diagnosing that broad ligament hematoma in postpartum mares. We can perform the ultrasound either through the abdominal wall or transrectally to see that area.
Right, so combining all these tools, history, exam, blood, scoping, imaging, that's how you piece the puzzle together. Okay, so once it's diagnosed, what are the steps to actually help these horses? And, what's the outlook? What are we looking at for their recovery and maybe their future performance? It sounds like a real tightrope walk between managing the immediate crisis and treating the underlying cause.
It really is a balance. For a horse experiencing acute, severe hemorrhage, the absolute primary goal is stabilization. We need to support them hemodynamically until their body can form stable clots and stop the bleeding. This usually involves aggressive fluid resuscitation. That means large volumes of isotonic crystalloid fluids, like lactated Ringer's solution. Sometimes we use hypertonic saline initially for rapid expansion of blood volume, often followed by colloids like plasma or synthetic colloids to help maintain that volume.
So lots of fluids to replace what's lost.
Exactly. And if the anemia is severe, say the PCV drops below 12 to 15%, though the decision is based on clinical signs too, not just the number, then a blood transfusion from a compatible donor can be absolutely life-saving. Oxygen therapy might be needed if they're having trouble breathing or getting enough oxygen to their tissues, and pain management is also critical, using appropriate drugs like NSAIDs or sometimes opioids, depending on the situation.
Okay, that covers the emergency response. What about treating the specific causes, like EIPH?
Right. For EIPH management, probably the most common medication used, especially in racehorses, is furosemide. The brand names are Lasix or Salix. It's a potent diuretic, usually given intravenously about 4 hours before exercise. It works primarily by reducing blood volume, which in turn lowers the pressures within the pulmonary circulation. Studies show it can reduce the severity of EIPH bleeding by maybe 80 to 90%. Now, it's really important to mention that its use on race day is quite controversial and is banned or restricted in many racing jurisdictions worldwide.
Ah, okay, that's a key point.
Yes. Another non-medicinal approach is using external nasal strips, like the Felair strips. These help to physically support the nasal passages and reduce airway resistance, which might lessen the negative pressure swings contributing to EIPH. And then general management like rest, especially after a significant bleeding episode, and controlling the environment to minimize dust and allergens, which helps reduce any underlying airway inflammation, is also very important.
Makes sense. What about those clotting disorders?
If it's a specific coagulopathy, the treatment needs to be targeted. For something like hemophilia, they might require specific factor replacement, which usually means transfusions of fresh whole blood or plasma, which contain those factors. For vitamin K antagonist toxicity, the antidote is vitamin K1 administration. If it's DIC, treatment is incredibly complex and focuses on managing the underlying cause, like sepsis, plus supportive care, potentially including heparin in some phases and transfusions.
And trauma cases.
Traumatic injuries often require surgical intervention. That might mean exploring the wound or body cavity, finding and ligating bleeding vessels, repairing damaged organs if possible, or sometimes removing a severely damaged organ like the spleen. Large hematomas might also need to be surgically drained if they're causing problems.
And the broad ligament hematoma in mares.
That's primarily managed with intensive supportive care fluids, pain management, keeping the mare quiet. Surgery is usually considered extremely risky and is rarely attempted due to the difficulty of accessing the bleeding vessel and the friability of the tissues. It's often a case of supporting them and hoping the bleeding stops on its own.
So it really is that balance of immediate crisis response and then these very specific therapies depending on exactly what went wrong.
Precisely.
What about the prognosis then? What's the likely outcome?
Well, the outlook is highly variable, as you might expect given the range of causes. For EIPH, most horses can certainly live a normal lifespan. However, the prognosis specifically for continued high-level athletic performance is often considered guarded. Repeated episodes of bleeding, especially moderate to severe ones, can lead to cumulative lung damage over time, things like fibrosis, scarring, and chronic inflammation, which can permanently impair lung function.
So it's not just about surviving the bleed itself, it's that long-term insidious wear and tear that can really limit these incredible athletes.
That's a very good way to put it. For traumatic hematomas, the prognosis is generally good if they're localized and don't involve critical structures. They usually resolve over time, though large ones might need draining. Broad ligament hematomas, however, have a guarded to fair prognosis. Mortality rates can be quite high, perhaps up to 50% in severe cases. And mares that do survive might unfortunately face future fertility issues due to scarring or adhesions. And then, severe catastrophic internal hemorrhage, like an aortic rupture or a ruptured spleen with massive blood loss, often carries a grave prognosis and can be rapidly fatal, sometimes before any effective intervention is even possible. So across the board, the key message really is that early diagnosis and rapid aggressive intervention are absolutely crucial for improving the chances of a positive outcome.
We've definitely journeyed deep into the hidden world of equine interstitial bleeding today. We've peeled back the layers from those, tiny stresses on lung capillaries, all the way to the major life-saving interventions that veterinarians employ.
Yeah, and what's really fascinating here, I think, is how incredibly finely tuned a horse's physiology is, how their bodies function right on the edge during peak performance, and also how seemingly subtle signs, like just slowing down a bit in a race, can actually be critical indicators of potentially severe internal challenges. It really underscores the immense complexity hidden beneath their magnificent power and grace.
Absolutely. So knowing all we've discussed today, thinking about everything from EIPH and athletes to those sudden catastrophic bleeds, what stands out most to you about the incredible resilience or maybe perhaps the inherent vulnerabilities of these magnificent animals, especially when we push them to their absolute physical limit? Something for you listening to really mull over.